Okay, this is going to be a presentation on mitochondrial disorders and genetics. So the objectives include recognizing the inheritance patterns and symptoms of pyruvate carboxylase and dehydrogenase, and recognize the function of the mitochondrial genes and inheritance patterns for these genes. So mitochondria are intercellular organelles. Unlike most other intercellular organelles like the lysosomes or peroxisomes, they have their own circular DNA. And it's kind of a symbiotic relationship with the cell in that, and it's believed that this circular DNA, which is usually seen in prokaryotic organisms, somehow integrated into eukaryotic cells, and it's responsible for energy, but it also needs the cell. It's kind of a joint combination thing because there's over 200 genes in the nuclear DNA that's important in constructing this mitochondria so it can make the energy for the cell. The mitochondrial genome contains 37 genes that encode for 13 proteins and 22 tRNAs and 2 rRNAs. You don't need to memorize that. Maybe the 37 genes. 13 mitochondrial protein, instruct enzyme complexes in the oxidative phosphorylation system. And the oxidative phosphorylation system is important in creating energy. So common disorders associated with mitochondrial inherited disorders include MELAS, MERF, and LHON. So again, these 13 proteins, here we got MELAS, LHON, MERF. So organs affected by mitochondrial mutations, organs with high energy needs are the most affected with this. And this includes the heart, muscle, brain, vision, hearing. So here we have muscle weakness, fatigue, myopathy, neuropathy, in the heart, conduction defects, Wolff Parkinson White cardiomyopathy, ophthalmoplegia, liver issues, Fanconi syndrome, diabetes mellitus, Pearson syndrome in the blood, sensory neural hearing loss, pseudo-obstruction in the GI tract, and then the brain, seizures, myoclonus, ataxia, stroke, dementia, migraine. So when a patient has a number of seemingly unrelated issues, you should think mitochondrial. Unfortunately, my patients often come to me because they use Dr. Google a lot, and everybody thinks they have a mitochondrial disorder. But anyway, mitochondrial inheritance, the mitochondria are inherited exclusively from the egg. So here we have a brother and sister who are both affected with some type of disorder. The son, this brother here, all of his children and his children's children are not affected. However, the sister, all of her children are affected. None of her son's children will be affected. All of her daughter's children will be affected. So this is the typical pedigree that you would see with a mitochondrial disorder. But just to make this a little bit more complicated, in some cases the mother has no symptoms or very mild symptoms of a mitochondrial disorder, but could have a child with more severe. And that's because when the mother's divvying up her mitochondria, once she has symptoms, all of her kids will be affected. But if she doesn't, let's say 20% of her mitochondria have a mutation, this red one indicates the mutation, she could give in her egg 80% of those mitochondria. And this child could have severe disease, maybe 50%. They could have probably more moderate disease, and 20% like her, either mild disease or maybe no symptoms. So that makes looking at the family history a little bit more complicated if this mother was the one, and we're going to show you that in a second. So here, normal mitochondria, mutated mitochondria, and here is the nucleus, and this child could get all abnormal mitochondria and be affected, mostly abnormal. They may be affected with some mild symptoms, but if they get mostly normal mitochondria or all normal mitochondria, they're not going to have symptoms. So here is a pedigree of that particular scenario where mom does not have symptoms of a mitochondrial disorder. Okay, so she doesn't have any symptoms, but she has 2 children that are affected and 2 children that are not. The son that's affected, all of his children will not be affected, but the daughter who is affected, all of her children will be affected. This son is not affected and none of his children will be, but this daughter is not affected, but she has affected children. Because she might have a normal child, but some of the first two are affected. So that is the more complicated way to live. But this is only if this mother's not affected. Oxidative phosphorylation is the main job of mitochondrial genes. The mitochondria is the powerhouse of the cell, and 20% of the proteins responsible for oxidative phosphorylation are coded for in the mitochondria, and those coupled genes in the mitochondria. A point mutation of a mitochondrial gene can result in non-functional protein that can affect ATP synthesis or energy production. This is a little bit of a complicated slide, and I don't expect you to know all these complexes, although biochemistry probably will. But I just want to show you how complex 1, 47 subunits, 7 are mitochondrial, 40 are nuclear. Complex 2, 4 subunits are all nuclear. Complex 3, 1 mitochondrial, 10 nuclear. Complex 4, cytochrome C oxidase, 3 mitochondrial, 10 nuclear. And complex 5, 2 mitochondrial, 15 nuclear. So even in the respiratory chain, most of them are actually nuclear. But we're going to go back for a second to talk about the mitochondrial genes, so some of those 13 proteins. So MELAS is the most common of the mitochondrial disorders, occurring in 1 in 4,000 individuals. It's caused by a mutation in the mRNA of the mitochondrial genome. Symptoms usually begin during childhood but can occur at any age. Symptoms include muscle weakness, acute hemiparesis, vision abnormalities, seizures, and migraines. Lactic acid is often elevated. And we see ragged red fibers on muscle biopsy, which I'm sure Path will do a better job than me showing you that. Febrile illness can better trigger these. But here we have MRF. So we just talked about MELAS. MRF looks very similar, but here's these ragged red fibers. It's caused by the mitochondrial TK gene. Symptoms usually begin during childhood and are very similar, include muscle weakness, ataxia, seizures, optic atrophy, hearing loss. And so Leber, the reason I like to talk about Leber is this is the one most MELAS and MRF do not survive to reproduce. But Leber optic neuropathy does. It's characterized by rapid onset blindness and early adulthood secondary to optic atrophy. So if the mother is a carrier for one non-functional copy, all of her children will inherit that. Whereas if the dad, who has blindness because of Leber optic neuropathy, none of his children will be affected. And it's caused by the mitochondrial ND4 gene. Sex bias occurs, and this is kind of interesting that only 10% of females with this abnormal gene will develop blindness, but 50% of males will develop blindness. So while the male's not going to pass it on to his kids, he's much more likely to develop blindness, and I don't know why. So mitochondrial disorders with Mendelian inheritance. Remember I told you there's only 30-something genes in the mitochondria, but there's 200 genes in the nuclear genome that have to do with all the functions of the mitochondria, including oxidative phosphorylation. There are a number of, nuclear disorders include Kern-Sayer, Leigh disease, pyruvate carboxylase, and pyruvate dehydrogenase. So I want to talk about pyruvate dehydrogenase and pyruvate carboxylase in a little bit more detail. The gene for pyruvate dehydrogenase is located on the X chromosome, so it's an X-linked disorder. The enzyme is responsible for converting pyruvate to acetyl-CoA, and when the enzyme does not function correctly, there's excess pyruvate to convert to lactate. So, and just to go back to this, so it's an X disorder. So females, if she's a carrier, half of her sons will be affected, half of her daughters will be carriers, and half of her sons will be unaffected. So PDH gene is located on the X chromosome. As I said, it occurs primarily in males, progressive cognitive delays, low muscle tone, seizures, abnormal eye movements. Management includes vitamins, including B1 and carnitine to maximize mitochondrial function. Carnitine, as we talked about probably last year when we were talking about fatty acid oxidation disorders, is really important in shuttling stuff for the mitochondrial gift for energy inside the mitochondria, so we want to maximize that by giving extra carnitine. Pyruvate carboxylase, on the other hand, is inherited. It's a nuclear gene in a recessive fashion. It's seen in both males and females, and usually there's no history of the disorder. Both parents are carriers, though, if you have an affected child. Clinical presentation, usually in the first few months of life. It affects the ability for pyruvate to be converted to acetyl-CoA. As a result, you have elevated pyruvate that then can get converted to lactate. And so failure to thrive, developmental delay, recurrent seizures, and metabolic acidosis due to this lactic acidosis because of the pyruvate being converted to lactic acid. And please refer to biochemistry because, again, they're way better than me at explaining that. Clinical approach of mitochondrial disorders, there are multiple high-energy organ systems. That includes the heart, the brain, vision, and hearing that don't seem to make sense. Like, what? They have vision problems, they have hearing problems, and they have a cardiomyopathy. This doesn't make sense. Didn't acute or even coincide with the illness? Did the acute event coincide with this illness? Like what happened? Like, and sometimes again, the acute event that you need more energy and you just don't have it, so they really seem to go downhill because of that. Does the patient have acidosis? Do they have lactic acidosis? Is there a family history of similar disorders, and what is the pattern? If you have no idea what's going on, consider mitochondrial. So mitochondrial disorders involve nuclear and mitochondrial genes. Mitochondrial disorders include MELAS and MERF from mitochondrial genes. And again, there's lots of other things that could be nuclear inherited. So here is a question I took from a USMLE book. A 35-year-old woman and her husband seek genetic counseling before beginning their family. The woman suffers from a particular condition and wants to know the chances her child will be affected. Using the pedigree below, or actually on the side here, based on the mode of inheritance, what inheritance this patient is most likely suffers from which of the following disorders. So you have to look at this pedigree and say, what's the inheritance pattern? And then you have to look at these possibilities and figure out what their inheritance patterns is. So all of her children are affected, none of her son's children are affected, all of her daughter's children are affected. So are any of these mitochondrial, because this looks like mitochondrial, and this one is recessive, dominant, recessive, recessive. So she's 35, she probably doesn't have Tay-Sachs. The only other thing, it could be a dominant, and so it doesn't tell you what this is, but when you look at this pedigree, you say this is mitochondrial. And as I said, Leber hereditary optic neuropathy is the most likely, and she might not even have vision loss. So again, this is, I didn't write this question, I just took this from a USMLE book. So this is how you have to look at these pedigrees to answer these difficult questions.